frontline health workers are the backbone of effective health systems, and they play a crucial role in providing health solutions. They are the first link in providing healthcare and many life-saving treatment facilities for millions of people. And there is abundant evidence that well-supported frontline health workers bring about essential improvements in health conditions, especially during the COVID-19 pandemic. To celebrate the dedication of COVID warriors, Northeast Live brings you this exclusive report.
Time you get irritated, you get frustrated.
We have tried our best to stop COVID from spreading.
Many patients died. On the day of discharge also, few patients died.
So many of our staff got infected.
These are not just words, these are emotions. They are our COVID heroes and crusaders. They are our frontline workers. From day one, they have soldiered the front lines fearlessly to save the rest of us. They have been away from their families, worked endless hours. They have put themselves through physical exhaustion coupled with the daily pain just watching deaths all around them. They are leading the war against COVID-19. But the question is how they have managed to motivate themselves during this difficult time.
Personally, if I have to say that, tell you what, if you see in GMC, we had psychological briefing done to all the doctors, the healthcare workers, the cleaners. There were people, there were doctors from the psychiatry department. There were Moram, there was a channel that been built by them. They used to talk to the COVID patients also. Then physical activities like yoga was started, online yoga through video conferencing. We used to teach the patients, the non-symptomatic patients inside the COVID ward. And these are things which de-stressed most of the doctors, paramedics, and even the patients.
Terms like social distancing, self-quarantine, and the pandemic are punctuating household conversations and raising pertinent questions. There is doubt, there is uncertainty, and above all, there is fear. And our frontline workers are feeling the brunt of it all.
So initially, when the pandemic first started, there was lots of fear, there was a lot of panic. People actually did listen to the government protocols which were put forth. But of late, people have started becoming more complacent. Case in point is like when we have these containment orders in places where we have COVID positive patients. Now people are starting to challenge those kind of containment orders. There have been instances where medical officers have been threatened because of the containment orders which had been given by them, which were then enforced by the district administration. So we're having those kind of problems. Then when it comes to vaccination, there's a lot of hesitancy when it comes to vaccination. A lot of people are not willing to come forward for vaccination.
Despite the challenges, our health workers, especially doctors and nurses, are committed and render selfless service to the treatment of their patients.
During this COVID times, yes, it has been a very challenging time of my whole career. I have been, I think, more close to the patients as compared to in the past. I have been able to understand those patients, those feelings, the thoughts of the patients as well as the attendants who are waiting outside. So it has been a very enlightening job, and this I think I would carry on in the future as well.
They are the warriors who are fighting this disease on the front lines, putting their lives at risk and staying away from their loved ones for a long period of time to keep others safe.
Personally, I myself was afflicted during the first phase, and I was in the ICU for almost 10 days. So after defeating COVID, I again had to put aside my fears and then come back and join duty again. In spite of that, the fear of going back home and infecting my kids and my other family members was always there. But we had to keep all those things aside and had to fight for our patients. So definitely it was very challenging. The patients' conditions, the attendance, they all, like we had to keep our personal fears aside.
In the same breath, there are other frontline workers moving out of their comfort zones, investing their heart and soul to save precious lives.
When initially what happened when I go home, then I was really afraid that probably I'm bringing the infection home and my kids will be getting that. Every one of us actually had that fear inside us. Gradually, we took care of that. We changed dress and we go home directly after and having a bath or cleaning ourselves. And that way, this has become normal now. So we don't feel anyways. Probably after some time, once the pandemic is over, it will be difficult to go back to that previous dress code with the doctor's kind of dress code in outpatients.
Let's take a listen to a typical day at work for some of the health workers.
We have to give more moral support to the patients and the patients' party. You know, like patients, like as soon as they came to know that it was a positive, they try to become so reserved, and people are isolated and all. They don't even want to talk and all like that. So we, in our part as a nurse, as a health worker in the front line, so we try to support first.
Like one ward boy, one sister, one technician, and one doctor with full PPE kit. Full PPE kit in our triage area, like in our front of our emergency department. And we have one ARU department also. It's acute respiratory unit. First we used to triage the patient, then doctor used to go to patient and he will assist the patient and he will come on what to do or what to not to do. If the patient is suspected like cough, headache, symptomatic patient, then he will tell us to do like some test, and we have monitor also. We used to monitor the patient.
Well, in this fight, the frontline workers are not left to their own devices. The government is playing a crucial role in contributing to this humble cause to help mitigate the burden weighing down upon them.
Government has given everything. We got everything from the government. If you talk about antibody cocktails, those are very expensive drugs. Government of India, Government of Assam ensured that we got PPE kit, ensured that we got N95s, ensured we got sanitizers, ensured we got all those medicines free of cost. So there's a huge support given by the Government of India as well as Government of Assam.
And just when COVID has wreaked havoc across the globe, it has failed to dwindle the fire burning inside our doctors and frontline workers. These real-life heroes have simply restored our faith in humanity, a clear reminder that there is indeed hope at the end of the tunnel. News Desk Report, Northeast Live.